Hello, this is Group One presenting our entrepreneur ethics business plan. I'm joined by Ivan and Jonathan, and this is Senate. Uh, firstly, our company name is Halcyon. Going into our long-term vision statements, the goals for our company is to be dedicated to helping individuals reclaim their lives from addiction while guiding them back to a healthier time. Utilizing a smart ring and an accompanying act on smart devices such as smartphones, tablets, and smartwatches, Halcyon empowers users to monitor their health metrics, identify nearby individual triggers, and track their sobriety milestones. The app measures vital indicators, including heart rate, oxygen levels, and stress levels, to detect craving associations with addiction. Through geolocation capabilities, it alerts users when they are approaching potential triggers like bars, dispensaries, liquor stores, or casinos that might inspire relapse. When the app senses an increase in cravings, indicated by changes in health, metrics, or proximity to triggers, it offers a range of supportive strategies to help users remain committed to their recovery journey. These strategies may include physical and mental release exercises, contact information for the nearest addiction recovery centers like SAM and HSA, access to immediate chat rooms with AI guidance counselors, opportunities to join virtual group meetings, options to schedule personal counseling sessions, participation in recovery forums with fellow users, or writing in a virtual journal for distraction from cravings. Halcyon employs a positive reinforcement through daily check-ins that celebrates users' sobriety and milestones, rewards checkpoints offering prizes and gift cards, and promotional codes for trial subscriptions to various helpful services. Importantly, data collected from users is strictly used to enhance app functionality, improve accuracy in detecting environmental triggers, and health changes related to cravings and foster community growth.
The origin of our idea comes from our understanding that the road to sobriety is bumpy, and one major hurdle that stands in the way for many people is relapse. It takes a great deal of strength to refrain from going back to your old habits, and we wanted to make the journey easier for those seeking a better life. We created this app with the community in mind and wanted to make it a social hub for those who want to talk about their sobriety with others dealing with similar experiences. The ring was created to observe stress levels and offer activities outside your addiction to help fill the void with new and healthy habits. We made daily push notifications to help remind you of your goals and keep you on track because we know the journey to sobriety is a daily battle and we want to be there with you every step of the way. Our purpose, values, and mission statement is that the purpose of this app is to increase the likelihood of a successful recovery for users. We value and promote happy, healthy, and addiction free lifestyles. Our mission is to help people stay addiction free and continue on their path to sobriety. Some key questions we've asked ourselves are: how can we best equip others with the tools they need to achieve sobriety? What does it mean to spend your time effectively? And how do we reach our target audience? Who is our target audience? And how can we tackle our users' problems in a meaningful way?
To begin strategy with ethical impacts and ethical safeguards, we'll begin with OKR 1. Objective. Halcyon's objective to increase new users' daily engagement on virtual meetings for the first 90 days will help them stick to their journey towards recovery. Multiple addiction recovery centers have the focal point of 90 meetings in 90 days. Carolina Center for Recovery states people new to sobriety receive a lot of advice from doctors and addiction treatment center staff to attend 90 meetings in 90 days because they will help to get you out of the house and into the world, help deepen your commitment to sobriety, and increase your sense of community. In the first year, we would like to achieve 65% daily active users. Key result would be new users will be scheduled to attend 90 meetings in their first 90 days, followed by users will be asked to contribute to forums weekly for their first year. For metrics, tracking daily active user percentage or DAU percentage will be used to help track whether users are using the application daily, and a 90-day retention rate will be used to track for how long new users maintain daily interaction. Sustained user interaction will be achieved through daily tasks and reinforced goal accomplishment by supplying users small rewards that are daily, weekly, and on a 30-day period. Support forums to help those who are looking for activity, strategies, or social interaction with people who deal with a similar difficulty will also be provided. Ethical impacts or issues. Privacy and data security. Halcyon will collect multiple sources of sensitive data from users that will be used to increase the effectiveness of the application. Data such as daily locations and health levels, interactions in the forums, and sobriety dates are all sensitive data that must be handled with care. Halcyon must employ professional ethical standards described by Health Insurance Portability and Accountability Act, HIPAA, the General Data Protection Regulation, GDPR, and California Consumer Privacy Act, CCPA. Cybersecurity practices are also important to conform to so that users feel confidentiality with the application and Halcyon as a company. Users must be made aware and prompted to agree to the tracking of such information to avoid a similar case such as Google's class action lawsuit in 2023 for disclosing users' private personal information to third parties. Furthermore, data anonymization should be applied whenever applicable so that it cannot be easily linked back to individual user profiles. Stigmatization and discrimination. Disclosure of sensitive data can lead to users being down upon by their community and the sensitive data were to be released. Damages such as job prospects or isolation can become issues for users. Risk of data misuse by third parties. Although Halcyon's goal is not to benefit from the tracking and selling of data, collaborations with other companies to help employ better methods of developing application software can lead to the mistreatment of the private data. Halcyon must ensure that collaborative partners also hold stringent privacy and security practices. Ethical safeguards include transparency and clarity, open communication of data collection, and listing all outside parties that will have access to the information must be clearly stated in the terms of use. Reasons for data collection should be communicated to the users for a solid understanding of how and why the data is collected. Any updates to policies, changes to software, or additions or removals of collaborations with third parties should be disclosed as well to maintain a trustworthy relationship between Halcyon and users. A thoroughly thought out terms and conditions should be written out with the help of organizations such as International Association of Privacy and Professionals, IAPP, HIPAA, GDPR, and CCPA. Data security measures. Halcyon will implement de-identification of users' data to keep the majority of data collected private, anonymous, and safeguarded from the abuse of outside parties who do not hold the user's best interest in mind. Users' location services, health levels, and sobriety date will be de-identified from the user's profile to ensure the user's privacy is protected. Lastly, informed consent. Halcyon will allow users to select what services they would like to implement and which services they do not. Users must accept what services they select so that they are in control of what data is collected by Halcyon. Also, users must be allowed to select certain services to be applied while others are not. Complete transparency of how data collected from each service is used gives a good understanding to the user of how they would like to move forward with using the app. Explicit permission and granularity of consent are imperative to have users in control of their data.
One objective in OKR2 is Halcyon will improve product effectiveness and reliability by reducing user relapse rates through data collection and self-reported data surveys from users. The app will collect and analyze user data such as heart rate, geolocation, and app engagement to identify when someone is at risk of relapse and develop predictive models based on the user's historical data and behaviors to push alerts and personalized interventions. The app will also regularly guide user surveys on relapse incidents and cross-check these with app usage trends and stress levels collected from the ring. Users at risk of relapse must receive daily, timely notifications and actionable recommendations. The app's demographic will be users between the age of 25 and 55, focusing on those in both early and sustained recovery, and it is equally distributed amongst gender and race. Some key stakeholders would include users, addiction treatment centers, and public health organizations. The stakeholders are in a symbiotic relationship of sorts. Some users using the app may be recommended to a nearby substance abuse and mental health administration, while others may have been recommended the app/ring from their local addiction treatment centers. Moving on to ethical impacts and issues. The first one is privacy and data sensitivity. The Halcyon app/ring collects health data, including stress levels and location history, to monitor users and alert them of potential relapse risks. Handling this sensitive information raises privacy concerns, particularly in compliance with HIPAA, the Health Insurance Probability and Accountability Act, or the General Data Collection Protection Regulation. One such scenario is if Halcyon collects sensitive data like users' stress patterns and locations, and this data is later exposed or shared with third parties without consent. It can lead to severe consequences. One example is the Google Health case, in which Google was scrutinized for accessing patient health data without consent through its partnership with Ascension Health. They received backlash due to the lack of transparency and consent from patients. The second one is predictive algorithm bias. The AI models used by Halcyon app to predict relapses amongst users could unintentionally create bias or inaccuracies. If the data used to train these models is biased, it can disproportionately impact certain user groups. Predictive algorithms often carry the risk of discriminatory outcomes. For instance, if the Halcyon algorithm incorrectly flags the user as being at risk for a relapse based on skewed data, this could cause unnecessary anxiety and potentially push the user away from the app. Alternatively, the system could miss a relapse warning, leaving the user without the support they need. Finally, the app's location tracking features, while helpful in identifying high-risk areas that can lead to relapse, can be viewed as a potential infringement on personal freedoms. For instance, if the app tracks users excessively, it may come off as invasive. For example, if a recovering gambling addict is repeatedly flagged for simply passing by a casino on their commute to work, this could create a sense of surveillance, undermining their trust in the product. This is akin to ethical debates that arose from the Apple iPhone location track case, where users were unaware that their phones were storing detailed location history. Moving on to ethical safeguards. The first is data minimization and consent transparency. One primary concern with Halcyon is the sensitive data being collected. Data minimization ensures that only essential data is collected and retained by the app, while consent transparency means users will have clear and concise control over the data they share with the app. Ethical experts related to this include ethical consulting firms or professional associations such as the International Association of Privacy Professionals, with knowledge of HIPAA, GDPR, or other regional data protection regulations, will help ensure compliance. And said implementation includes the safeguard can be implemented by conducting comprehensive data audits to identify non-essential data, developing a consent management interface in the app with granular options to opt out of specific data collection, and ensuring the user experience remains intuitive and accessible with disclosures about what each of these data options entails. The second one is fairness and inclusivity in predictive models. To reduce algorithm bias from Halcyon's machine learning models, they must be trained on diverse datasets to avoid disproportionately affecting certain user demographics. Regular algorithm audits will be conducted to align with best practices for algorithm fairness, as discussed in the literature of the ethics of algorithms, which emphasizes the importance of fairness and inclusivity in automated decision-making systems. Implementation for this can be includes using fairness-enhancing techniques like data reweighting to ensure underrepresented groups are adequately represented, and continuously refining the model by conducting regular bias audits that test the model's decisions across different demographics. Finally, we have location tracking limitations and user autonomy. Given the sensitivity around location and tracking, Halcyon needs to implement location tracking limitations to ensure that users maintain full autonomy over when and how their movements are tracked, such as a manual toggle for location services and geofencing thresholds when tracking is activated under specific user-defined conditions. Implementation for this looks like developing location service toggles in the app, which enables users to control tracking easily, creating geofencing features that allow users to define high-risk locations manually, and ensuring all location data is autonomized and encrypted to prevent misuse.
My turn?
Yeah.
Okay. For the third OKR, Halcyon's objective is to improve our clients' well-being and quality by helping them through one of the most difficult processes in the world, addiction recovery. One of the primary challenges of this task would be finding our target audience and challenging stigmas leveled against those in recovery. According to a 2023 United States National Survey on Drug Use and Health, 48.5 million Americans aged 12 and older battle a substance use disorder in the past year. Within a year, we would like to reach at least 100,000 of them. We will achieve this by working with addiction rehabilitation centers and other healthcare agencies. Our core demographic would be those struggling with substance disorders, and our key stakeholders would be rehab centers, those in recovery, and any healthcare organizations that would work with us. Some of the ethical impacts and issues that we'll address have to do with privacy and data sensitivity. Our application will be collecting several kinds of sensitive data, including but not limited to users' vitals, biometrics, their geolocation, and app usage data. By collecting this information, there are several professional ethical standards we must adhere to, including HIPAA and GDPR. For a given scenario, if Halcyon fails to apply cybersecurity practices, we are more likely to give threats an opportunity to breach user data. Such a case has actually happened with the Advocate healthcare data breach, in which Advocate Medical Group failed to apply the basic principle of encryption. Another concern would be algorithmic biases. In the past few years, have proven that predictive algorithms can make assumptions that don't necessarily align with reality due to drawing from discriminatory sources and creating worse outcomes for users due to this bias. If the algorithm were to flag users at risk, If the algorithm used to flag users as at risk is too flawed, then users may be unnecessarily flagged and be given undue anxiety about the status. On the contrary, users who are not flagged when they should be are also at risk due to not getting the warning when they need it. Some ethical safeguards we will be taking against these issues. include encryption and data minimization, by only collecting the absolutely necessary information for the processes of the application and encrypting what is actually collected, we can prevent incidents like that of Advocate Medical Group cybersecurity. Wait, we can prevent incidents like that of Advocate Medical Group. Cybersecurity specialists would be employed for the purpose of ensuring our encryption and minimization practices are up to industry standards. The effectiveness of this practice will become more apparent the longer we go on without a breach in security, and even more apparent after the first breach, so we can measure how effective our security practices were in minimizing this damage. To reduce algorithmic biases, it will be a matter of transparency and expertise. The implementation will involve complete clarity on how the algorithm makes decisions and input from ethical experts with a specialization in AI fairness. We can measure the rate of false positives to ensure the safeguard's effectiveness.
Next, we have the ethics policy. Some ethics policies that were not included in our OKRs would include empowerment over dependency. Halcyon's goal is to be a tool to empower its users to become more resilient against the everyday struggles that patients encounter while recovering from addiction. The design of the app, it features support tools that help users build coping mechanisms, which in turn encourage self-reliance for users. Professional help is incorporated into the app, which is meant to be used as a tool with the help and guidance of a professional worker. Halcyon would like to make it clear that it is not a substitute for professional help, but rather a tool to be used alongside professional help. Avoid exploitation. Avoidance of exploitation is very important for the betterment of our clients. Research with experts in the field of recovery, along with the patients themselves in case studies, will ensure that the app does not exploit users' vulnerabilities. These vulnerabilities can include, but are not limited to, the pressuring of users to spend their own money on premium features, rewards for consent of data collection, etc. Community peer support. Community peer support is imperative for patients to find success in recovery. Forums hold a safe space for users to interact with others. The establishment of clear rules and guidelines, along with moderators, help prevent harmful interactions between users. Penalty systems are placed in check to make sure people adhere to these guidelines. Users are given the opportunity to interact anonymously, as well to encourage open sharing while protecting one's identity. Crisis management. Crisis management is very important for the success of our clients. Emergency protocols are included with the app for those who are in immediate distress. Crisis hotlines, emergency services, and physical and mental exercises are a few examples of how users can find guidance when dealing with stressors. The surveillance of users' engagement in the forums to ensure that it does not inadvertently trigger negative emotions or relapse are also very important. We also have research and continuous improvement. Continuous research and improvement allows Halcyon to better help patients. The collection of users' feedback is highly valuable and encouraged. This allows us as Halcyon to improve the app, address any concerns of users, and improve everyone's experience. Involving currently successful or those undergoing recovery in the process of the app development gives an insider look at how the app can be improved and best developed to ethically and effectively meet the needs of our patients. On our ethics board, we have Tristan Harris. Tristan Harris is a former design ethicist at Google and the co-founder of the Center of Humane Technology, an organization dedicated to relying technology with humanity's best interest. Harris has spent years advocating for ethical technology design, particularly focusing on reducing the addictive qualities of digital platforms. His background makes him an essential board member for ensuring our app prioritizing users' well-being and avoiding unintentional harm. His experience with ethical tech practices aligns perfectly with our company's mission to empower users struggling with addiction rather than exploit them. Brad Smith. Brad Smith is the vice chair and president of Microsoft, overseeing major initiatives in technology governance, privacy, and cybersecurity. He is also known for championing ethical AI and fair practices within the tech industry. Smith's experience in navigating complex ethical challenges in large-scale technology platforms make him a valuable asset to our board. His leadership would help our company maintain a strong commitment to ethical design and data privacy, two critical aspects of an app handling sensitive user information. Dr. Rosalind Picard. Dr. Rosalind Picard is a professor at MIT and the founder of the Effective Computing Group at the MIT Media Lab. She is a leading expert in using technology to address human emotional needs, with a focus on wearable tech and digital tech tools. Dr. Picard's research into how technology can support mental health and emotional resilience directly aligns with our app's mission. Her expertise would guide our company in incorporating evidence-based approaches that address the psychological aspects of addiction.
Moving on to the cultural policy.
Our cultural policy. Our core values. We at Halcyon value the health, well-being, safety, and privacy of our clients. We are committed to improving the health and well-being of those who use our services through facilitating recovery and an understanding of the addiction recovery process. We value our users' privacy and safety by maintaining good security practices and protecting our users' data. We believe in a holistic approach to recovery that includes emotional, mental, and physical well-being, recognizing that addiction is a complex issue that requires multifaceted solutions. Through our services, we aim to empower individuals to take control of their recovery journey with the support they need. Halcyon as a product and company is concerned with our users' health and aims to improve their overall quality of life, primarily by helping users reduce addictive behaviors and giving them valuable information about themselves in the recovery process. We offer tools and resources that support sustainable recovery while respecting each individual's pace and challenges. Our team is dedicated to providing a compassionate, understanding environment that fosters growth, healing, and resilience. Halcyon is motivated by the personal journeys and challenges faced by all those in recovery. We honor and respect the dignity and courage of all those who have undergone and are undergoing recovery. We strongly disapprove of environments that facilitate addictive behaviors and encourage those in recovery to position themselves in the best possible place to undergo a successful recovery. Halcyon would be honored to be a part of your recovery story. We work with you, not just as a service provider, but as a partner, ensuring you are fully supported in your journey. At Halcyon, we understand that one of the most dangerous, but sometimes unavoidable, parts of the recovery process is relapse. Using our product, we seek to minimize this behavior and provide proactive strategies to address setbacks before they become obstacles. Our tools offer real-time support, helping users stay connected to their recovery plan and to those who are part of their support network. Through continuous progress tracking and personalized recommendations, we aim to guide our users towards lasting success. A summary of our cultural policy could be our focus on health, safety, privacy, integrity, and recovery.
That concludes our presentation. Thank you very much for listening.